Welcome to my channel. I'm Sophia. Today, we're going to discuss folic acid supplementation and why it is essential in early pregnancy. If you are planning to conceive or are already pregnant, I believe today's topic will be very helpful for you. Pregnancy is a journey filled with anticipation and challenges. From the moment they conceive, expectant mothers start to focus on their health to ensure that their baby can grow smoothly. During this process, many nutrients are crucial, among which folic acid is undoubtedly one of the most important. Folic acid, also known as vitamin B9, is especially important in early pregnancy. So why is folic acid indispensable for expectant mothers? Today, let's delve into the key role of folic acid supplementation in early pregnancy. 1. What is folic acid? Folic acid, chemically known as vitamin B9, is a water-soluble vitamin. It is widely found in leafy green vegetables, legumes, nuts, whole grains, and some fruits, such as spinach, avocados, and oranges. Folic acid plays several vital physiological roles in the human body, especially in cell division and DNA synthesis. Since the fetus develops rapidly in early pregnancy with active cell division and growth, expectant mothers need sufficient folic acid to support this process. 2. The role of folic acid in early pregnancy. Early pregnancy typically refers to the period from week 1 to week 12 of gestation. This stage is critical for the development of the fetal neural tube, which is the stage of forming the brain and spine. Let's specifically look at the main roles of folic acid in early pregnancy. Preventing neural tube defects. Neural tube defects occur when the fetus's spine and brain do not fully close during development, leading to birth defects. The two most common neural tube defects are spina bifida and anencephaly. Spina bifida results in the spine not closing completely, exposing the spinal cord and affecting the baby's motor skills and sensory functions. Anencephaly is a fatal condition that typically leads to infant death shortly after birth. Adequate intake of folic acid can effectively prevent these neural tube defects. Research shows that taking enough folic acid before and in early pregnancy can reduce the risk of neural tube defects by about 70%. Promoting cell division and fetal tissue development. In early pregnancy, the fetus's organs, tissues, and bones are in the initial stages of formation. Folic acid helps with the synthesis of DNA and RNA and plays a key role in cell division, supporting the normal development of various organs and tissues in the fetus. Therefore, a lack of folic acid can lead to abnormal cell division in the fetus, affecting its normal development. Preventing maternal anemia. Folic acid is beneficial not only for the fetus, but also for the expectant mother's health. During pregnancy, the mother's blood volume increases, requiring more red blood cells to support oxygen supply for both mother and baby. Folic acid plays an important role in the production of red blood cells. A deficiency of folic acid can lead to insufficient red blood cell production, resulting in anemia. Anemia during pregnancy can make the mother feel fatigued and weak, and even increase the risks of premature birth and low birth weight babies. 3. The best time and dosage for folic acid supplementation. After understanding the importance of folic acid, many expectant mothers may ask, when is the best time to start taking folic acid? In fact, folic acid supplementation should begin during the preconception period. Neural tube development usually occurs in the first 3 to 4 weeks of pregnancy, a time when expectant mothers often just discover their pregnancy and many organs are already developing. Therefore, doctors typically recommend that women planning to conceive start taking folic acid at least 3 months in advance to ensure there is enough folic acid reserve during the critical development period of pregnancy. The World Health Organization, WHO, and many obstetricians recommend that women in the preconception and early pregnancy periods, from 3 months before conception to 3 months after conception. Take a daily supplement of 400 micrograms μg of folic acid. However, for high-risk groups, such as women with a family history of neural tube defects or those who have previously given birth to a baby with a neural tube defect, doctors may suggest a higher daily dosage, typically 4,000 micrograms, for milligrams. 4. Dangers of folic acid deficiency. If expectant mothers do not supplement enough folic acid in early pregnancy, it can not only increase the risk of the fetus developing neural tube defects, but also lead to the following issues. 1. Premature birth and low birth weight. A lack of folic acid may lead to premature birth or low birth weight, both of which can adversely affect the newborn's health. Babies with low birth weight may face more health issues after birth, such as respiratory difficulties, infections, and developmental delays. 2. Maternal anemia. As mentioned earlier, a lack of folic acid can lead to a decrease in red blood cell production in expectant mothers, resulting in anemia. Anemia during pregnancy not only makes mothers feel weak, but may also increase the risk of postpartum hemorrhage. 3. Increased risk of other birth defects. In addition to neural tube defects, a lack of folic acid may also increase the risk of other birth defects, such as cleft lip, commonly known as hair lip, and heart defects. Although these defects are not fatal, they can have long-term effects on the baby's appearance and health and may require surgical treatment. How to get enough folic acid through diet. While folic acid supplements are the most direct way to ensure expectant mothers get enough folic acid, it is also essential to obtain folic acid through daily diet. Let's look at some foods rich in folic acid that expectant mothers can incorporate into their daily meals. 1. Leafy green vegetables. Spinach, kale, and mustard greens are among the richest sources of folic acid. 2. Legumes. Foods like lentils, peas, and black beans are excellent sources of folic acid. 3. Nuts, especially almonds and walnuts, which are rich in folic acid and other beneficial nutrients. For whole grains, brown rice and whole grain bread are also high in folic acid. 5. Citrus fruits. Oranges, grapefruits, and lemons are not only rich in folic acid, but also high in vitamin C, which helps improve the body's absorption of iron. Even though food can provide a certain amount of folic acid, the absorption rate of folic acid from food is not as high as that from supplements. Therefore, a combination of daily diet and supplements is the best approach. During folic acid supplementation, expectant mothers may have some common misconceptions. Let's clarify a few. Myth 1. Folic acid is only needed after pregnancy begins. In fact, folic acid reserves before pregnancy are crucial for the baby's early development, so women should start taking folic acid during the preconception period. Myth 2. The more, the better. While folic acid is vital for health, it is not the case that more is always better. Excessive intake of folic acid may mask symptoms of vitamin B12 deficiency and even lead to other health issues. Therefore, expectant mothers should take folic acid according to their doctor's advice. In summary, folic acid supplementation is irreplaceably important in early pregnancy. It not only helps the fetus develop healthily and prevents serious birth defects, but also protects the expectant mother's health. Expectant mothers should actively monitor their folic acid intake during the preconception period and early pregnancy, balancing diet and supplements to ensure the fetus is healthy at every step of its early life. By scientifically supplementing folic acid, every expectant mother can take simple yet crucial steps to lay a solid foundation for the baby's bright future. All right, that concludes our discussion on folic acid. I hope it helps everyone. On the journey of pregnancy, scientifically supplementing nutrition is a crucial step, and folic acid, as an essential guarantee for the fetus's healthy development, should not be overlooked. If you liked today's content, don't forget to like, subscribe to my channel, and share it with friends who might need it. See you next time. Bye.